Hey, I'm back. Much better. Everything okay?
Yep, it's all good.
Okay. Just let me know if you need any help.
Hello. I believe you're next. Come on back.
Oh, is he
I
deaf?
don't know.
Cool.
Maybe.
Hello. My name is Travis.
I'm Chris. Are you deaf?
Yes, I am.
Oh, cool.
Yeah, totally.
I prefer direct communication rather than going through an interpreter.
Yeah, I agree.
I am the HIV STI counselor and tester. And who is your friend?
Oh, sorry. This is my good friend Karina. She's here to support me because I'm a little nervous. She's a nurse, so she knows all about this stuff.
Nice to meet you.
Nice to meet you both. If there are any misunderstandings, please feel free to jump in and clarify.
Okay, thanks, I will. And Chris, you can always tell me if you want me to step out of the room.
Okay, fine.
When was the last time you had an HIV test?
Should I tell him?
Yeah, it's okay. It's important to be honest.
Well, I had a scare a month ago. The condom broke when I was having sex with an HIV positive guy, and I had to go to the ER to get PEP. They tested me that day, and I was negative. I have been taking the medication every day. This is my first follow-up visit for an HIV test. They told me to get tested for HIV after finishing the medications to make sure PEP worked.
Yes, it happens often, and can be scary. I'm glad to see you knew about getting PEP.
Yep, thanks to Karina, who told me about it.
Since this is our first meeting, I'm going to ask some questions that may seem personal, but please know that I have an open mind and there is no judgment here. It's important that we speak openly and honestly because your health is worth it, okay?
Okay.
Now back to my questions. We ask these same questions of everyone because your answers will help guide how to reduce your risk for getting HIV.
Fine. That's all right.
So, one thing we talk about here is body parts. I am going to ask some questions about the type of sex you have. Okay?
Okay.
First off, have you ever used your mouth on someone else's vagina, penis, anus, butt, or genital area?
Yes, it's a good time.
Thank you for sharing. Now, have you ever used your anus for sex?
Yep.
Okay, and have you used your penis for sex?
Of course.
Now, we can check all three sites for STIs. Your throat, anus, and penis.
Oh, okay. That makes sense.
When you have sex with other people, is it with their mouths, penises, anuses, or vaginas?
No vaginas for me.
Okay, I get that. But I've met many people who have sex with men and women both, even if they identify as gay or straight, so I always ask.
Yes, like someone might say they have sex with women, but unless Travis asks, you'd never know if that person is having anal sex with transgender women and may need different, safer sex strategies.
Okay.
Right. Now, continuing our discussion, approximately how many different people have you had sex with in the past 6 months?
Should I tell him?
Yeah, go ahead.
Okay. I am on a hookup app, and I have been meeting guys through that. It's pretty easy.
It is way too easy for young people these days. Where's the romance?
Hey, no judgment. You're just jealous. I would say about 5 to 6 guys in the past 6 months. That sound about right?
Yeah, that seems about right.
Okay. Have you ever had an STI?
Yes, about a year ago, I did have gotten... I forget what it's called again.
Gonorrhea. Is that the word you were looking for?
Yeah, that. Ugh, it was so painful when I peed.
I'm glad you got tested. Did you get treated?
Yes, and it went away a few days later.
Any other STIs in the past?
Not that I know of.
Okay. I recommend HIV testing and also STI testing.
Yeah, sure.
Now, I want to talk about your sex behaviors. We know from studies that receiving anal sex is the highest risk activity for HIV acquisition. Why is that? It's easier to tear the tissue, even tiny tears that you can't see with your eyes. HIV can travel into the blood through those tiny cuts. So, condoms are very important to prevent acquiring HIV.
Okay.
Oh, one more thing I forgot to ask. The other way HIV can often travel is through sharing needles.
Oh, I don't do drugs.
Okay, then we don't need to talk about that more. So, today, we will do HIV and STI testing. We will send it out to the labs and we'll get the results back within 1 week. In the meantime, remember the condoms. It doesn't matter if you are a man or a woman or what kind of sex you're having or with whom. Use condoms or other barriers. I cannot emphasize that enough. Please use condoms.
Yeah, I'll try.
There is also a new medication called PrEP, which you may want to consider. Are you familiar with that?
Yes, they told me when I'm done with PEP that I can just start PrEP right away.
We can discuss PrEP more after the test, if you'd like.
Yes, I'd like that.
Great. Now you can go across the hall to the lab to get your blood drawn for an HIV and STI test. We will teach you how to swab your anus and throat and have you pee in a cup for a sample too. That takes care of all 3 sites. After that, you can make an appointment to come back in 1 week. Okay?
Okay, I'll come back. Karina can come with me again, right?
Absolutely. See you soon.
Okay, thank you so much.
Thank you.
Sure.
Hey, let's take a selfie.
Seriously? Cut it out. Karina, come on.
Okay.
Hello, Chris. I'm ready for you.
Okay. Karina, come on.
Oh, sorry.
So, tell me, what are the results?
Your HIV test is negative. You don't have HIV.
Ugh,
Oh, thank goodness.
what a relief. So the PEP medication seemed to work.
Either it's working, or your sexual partner didn't have any HIV virus in the blood, and you weren't exposed. No way to know. You still need to get a test again in another 2 months.
No problem. I'm negative, and I want to stay that way.
Your STI test is negative too.
The STI test is negative too.
Would you like to discuss PrEP now?
That's the pill to prevent HIV?
Yes.
Yes, I'd like that. Thank you so much.
Sure.
For more information about where you can access PrEP in Massachusetts, visit www.mass.gov and search for Massachusetts Department of Public Health supported PrEP programs.
Want to learn more about PrEP or PEP? Check out these websites.